We're now joined by Dr. Jane Van Dis to talk about physician burnout and especially gender inequity. And she's the author of the paper, What's Missing in the Physician Burnout Dialogue? Equity. Welcome.
Thank you so much for having me. It's such a treat.
Set up the issue for us. There's some really startling statistics involved in this.
Yeah. So I began to think about this problem actually just a couple of weeks ago. I was at the district meeting, District 9, I live in California, and we were talking about physician burnout. And one of the physicians in the room noted that he had had 8 physician colleagues in his lifetime who had committed suicide. And the silence in the room that followed, and I know we were all thinking, what happened? Were there family events? Was there the loss of a child, loss of a job? And what I found when I started investigating burnout is that the stressors that oftentimes lead to burnout in physicians are not actually due to problems in their home life. They're actually due to work stressors. And then I started to think about the types of stressors that women physicians face in the workplace. And what I found was that there's a lot of gender inequity in the workplace that could be contributing to the fact that female physicians are more than 2, sometimes 3 times as likely to burn out. So they're more likely to go part-time or leave medicine altogether. And so then I asked myself, why is that? What would be contributing to that marked disproportionate? And I looked at over 10, 12 studies, and they all showed the same thing, whether it was examination of an internal medicine department, a pediatric department, a surgical specialty. In all of these studies, females were burning out at higher rates than men. So what we know about medicine right now, where we are today in 2018, is we know that there's a significant pay gap in every single specialty. So that pay gap is on the smallest end, around $20,000, but up into the surgical specialties as high as $120,000 a year, which ends up being quite a bit of money over the course of a woman's working lifetime. We also know that there are promotion gaps. For instance, in our specialty, OBGYN, only 25% of department chairs in OBGYN are women. We know that 15% of medical school deans are women. So just like the numbers that we're seeing reflected in the CEOs and in America's corporations, we're seeing this very wide promotion gap as well. And then the last component that I wanted to look at was really, what is the culture like for women in medicine? Are there elements of the workplace that lead to feelings of gender discrimination, sometimes unfortunately overt harassment? I mean, Me Too in medicine is definitely a component, and it's one that we as physicians and physician leaders, we have to address this.
What are the resources right now to address this issue that you're talking about, and then what else do we need to do? Why aren't they enough?
That's such a good question. I looked at a study actually in Japan, and they recognized that female physicians were burning out at higher rates than men, and they actually took steps to narrow the pay and promotion gaps and improve workplace culture. And what they found when they did that was that in fact physician burnout went away or equalized with male physician burnout. So we have some data. We don't have a lot of studies, but we have the beginnings of data showing us that if we can fix this problem, we can potentially mitigate the number of female physicians that are burning out. Interestingly enough, there was a summit in 2016, and 10 of America's leading healthcare organization CEOs got together. And the sole purpose was to try and mitigate burnout. What can healthcare organizations do to help with burnout? Because the loss of productivity and the ability of physicians to perform in the workplace is a huge economic impact on America's healthcare. So what they found was that the number one, or their first task that they recommended healthcare organizations do is to start to measure the effects of burnout, the types of programs that are effective, and the types of programs that are not effective. And now, it's funny because as a woman, I oftentimes hear of burnout sessions or seminars or weekend retreats where physicians will be asked to learn yoga or practice deep breathing or focused meditation.
Meditate.
Exactly. And I thought to myself, so with these burnout sessions, what we as physicians are being asked to do is take on actually yet another job, the job of preventing burnout. Which is antithetical because studies show that actually changes in organizational leadership have a greater effect on physician burnout than physicians taking on the task of trying to fix it themselves. And it just reminded me somewhat of the way in which, you know, you're given a tote bag when when you go to a seminar and you're sort of like, oh, here's your tote bag. Good luck fixing your burnout.
That's a good point. Well, you also make the point in the paper that having a breakout session at a conference like this is just not going to be enough.
It isn't going to be enough. It's a good start, and obviously there's no harm in the types of reflections that can happen in these types of sessions. But when you have, say, an OBGYN, on average a $40,000 pay gap between men and women, $40,000 would go a long way towards helping a woman to potentially hire some help for herself. We know that women physicians work on average about 9 hours more per week outside of the home than their male counterpart physicians. So that could be a contribution to why women are feeling more burnt out than men. I think fundamentally, in order to maximize the happiness and the productivity of the female physician workforce, of the entire workforce, what we need is what the UK has done recently, which is salary transparency, making sure that we understand where those salary determinations are coming from. We know from a JAMA article, unfortunately, that the pay gap starts in that very first year out of residency, a $17,000 gap between men and women before they've even started their job as an attending physician. And then obviously that gap only grows over time. So we need to have policies in place to have salary transparency. We need to have objective measures by which we promote women and men. And then we also need to examine our workplace culture and find out, are there ways in which women feel either discriminated against, held back? And again, this doesn't apply just to women. This also applies to underrepresented minorities. Okay. So one method that can help improve that as well is having really good sponsorship or mentorship programs to help bring some of those women and underrepresented minorities up in leadership, so that we can see a workforce and a leadership that reflects the population that we are.
That's a lot of good ideas. Thank you so much for being with us today, Dr. Jane Van Dis.
Thank you so much.